All right. So for this afternoon, okay, last week you had your major exam, and the last part of our prelim exam was an overview of the health information system. Okay, it was an overview of the health information system. So right now, we're actually gonna talk about your health information system head on. So this is not ano naman, this is not long, although I would be explaining some things, and we will be going deeper into the use of health information system, not only in the laboratory, not only in the hospital, but the use of health information system in general. So the objectives of this lesson is first for you to discuss the roles of health information system. So its role, not only again nga, not only in the laboratory but the entire hospital. Next is to enumerate the different components of health information system. So later on, we will be talking about the essential components of your health information system. And lastly, is to be able to identify the different data sources for health information. So last time we did talk about the fundamental components like your electronic health record, your personal health record, and your health information exchange. But to be talking about information or data, today we will actually be talking about specific data that you can see on those three components. Okay, so moving forward, we will be talking about health informatics. So health informatics again is the application of both your technology and systems in healthcare settings. So when we were discussing about health informatics during our last discussion for the prelim period, we did discuss about health information technology and health information management, and we said that it is the health informatics is actually the marriage between the two. So health information system, okay, so health information system, on the other hand, will now cover the different systems that capture, that store, that manage, and that transmit health related information that can be sourced from individuals or activities a of a health institution. So having said that, so let us just put the foundation clearly. Okay, let's just put the foundation clearly that the systems that we did talk about on health information technology is now being used for healthcare related or health related management of your information. So as we go along, we will be talking about we'll be talking about different examples of health information systems, such as this that as follows. So the first one is the disease surveillance system. So we do have a disease surveillance system like what we have right now with COVID-19. So the good thing about this is that um, the good thing about your disease surveillance system is that it will enable you it will also enable the policymaker, the government, and everyone on the position to actually do better mitigations with regards to the pandemic that is happening right now. So that disease surveillance system, later on I'll give you an example. um, this is surveillance system. It actually is available already here in the Philippines. So we are currently using this one. Okay. So secondly, we also have district level routine information system. So when we say district, these are for your your municipalities, your barangay. So we also have district level routine information system to make sure that the yung welfare of everyone who is in the community is also taken care of. Aside from that, we also have the hospital patient administration system, okay, and human resource management information system. So this talks about more on the administrative and of course the resourcing components in the hospital. When we say administrative, we're talking about yan, yung mga doctors, yung mga medical directors. So they do also have their own health what do you call this? They also have their own information system. And of course, ito, the human resource management information system, this is actually take for example, uh, Hindi nyo pa to nakikita first and foremost because you're still students, none of you are working. But the human resource management information system, here lies all the information of your employees, yung mga leaves nila, yung mga benefits. So everything are in here, okay? Everything are in here. In addition to that, okay, um, the one highlighted here are this, ay sorry, lumipat. The one highlighted here are your hospital information system, your laboratory information system, and materials management system. So these are very important, okay? These are very important. Why? Because this is the one that we are actually are very much concerned of. In addition to that is your of course yung disease surveillance system natin. So HIS, ayan, Health Information System, this talks about later on when we discuss it further in the succeeding chapters and the succeeding lessons of our book. So, hospital information system, okay, when we are talking about hospital information system, we are talking about the billing, even the registration and patient identification, it's all included there. The laboratory information system, on the other hand, this talks about doctors requesting for tests. Now, even once you enter the specimen into the machine, it will automatically run the examinations that was requested for that particular patient. And that is actually, that benefit is actually being given by laboratory information system. So in the laboratory information system, from the moment, take for example, we have Miss Ebrio. Miss Ebrio would have her blood extraction. Okay, would have her blood extraction. Take for example for cholesterol. Okay, for cholesterol. So once that she came in, okay, he will be registered automatically to the hospital information system for her information, her demographics, and then eventually the doctor will now be requesting tests for that particular patient. So take for example, cholesterol na. And then the moment that Miss Ebrio went to the laboratory, they will just be calling her name, will just verify, medtech na gumagawa nito ha, they will just be verifying her information, they will just verify um, certain information that are identifier that she really is Miss Ebrio. And then eventually, from the blood collection, from the processing, and even the releasing of the results to both to the patient and to the physician is also being done by laboratory information system. Okay? So I am giving you our like a big picture view of your laboratory information system. On the other hand, what about materials management system? So this is for the inventory. Okay? Even though we do have material management system, so most of our, like for example, most of the auditors still do count it, okay? They still do count those things. But when it comes to material management system, this is very important, especially in the laboratory, especially when it comes to our reagents, our supplies. Kasi hindi tayo po pwedeng maubusan ng mga supplies ng mga essentials natin in the laboratory. Sir, will there be a time that a laboratory would need to maybe some of you are wondering, sir, paano pag naubos yung supplies natin? What usually is the first line? Take for example, there is really no supplies yet, nothing is coming in yet. Most of the time we do send out. Okay, we do send out specimens to other laboratory. Okay, so take for example for St. Luke's, if in case there are some tests that are not available there, although seldom, kasi because St. Luke's already really got almost all tests. And then if take for example, it's not in St. Luke's Quezon City, it will be forwarded to Quezon's St. Luke's Global City. So ganun yung mga natin. But it should not be happening yung ganyan if only we have an efficient management information materials management system. Okay? So by the way, if you do have any questions, Miss Laika, I cannot see the chat box right now, but if ever there are, so please inform me. Okay? So moving forward now, so this is an example, okay? For the disease surveillance, we actually have the Philippine Integrated